This video is on Caesarean sections. We will examine the indications for C-sections as well as then compare the benefits and adverse effects associated with C-sections. A C-section is a delivery of a baby through a cut in the abdominal wall and uterus. Common indications include previous C-sections. So once you've had a C-section, it is highly recommended to not have a vaginal birth because the scar from the previous C-section on the uterus could rupture with the increased pressure of contractions associated with a vaginal delivery. Placenta previa or abruption, so if the placenta is too low in the uterus, or fetal or maternal compromise because this is an emergency and you basically want to get the baby out as quickly as possible, and this is achieved through surgery. Similarly, failure to progress or breech presentations are common indications for C-sections. However, it is important to note frank or complete breech presentations do not necessarily require C-section, but they do in about 90% of circumstances. The timings are also important to consider. There must be immediate C-sections if it is in an emergency, so a threat to the life of women or fetus if there is fetal or maternal compromise. Urgent but not necessarily immediate are if there is maternal or fetal compromise, which is not life-threatening. Alternatively, you could have a scheduled or elective C-section due to maternal preference or if you know you've had a previous C-section in the past. There are a variety of benefits to C-sections. It could be due to maternal choice, it's predictable, but medically there are lower rates of perineal pain, urinary incontinence, as you're less likely to have tears or pressure on the areas, as well as reduced chance of uterovaginal prolapse, as shown in this diagram, because your ligaments are under less force as it's not being contracted outwards. There are, however, adverse effects associated with C-sections. There are your generic surgery side effects, but we focus on more C-section specific factors. So there's increased abdominal pain, increased risk of pulmonary embolisms given the surgery, increased risk of bladder or ureteric injury. This is iatrogenic if they're accidentally injured in terms of opening up the uterus. It can also lead to hysterectomy, and as with all surgeries, there is a risk of death. There are a variety of complications. We will split this into intraoperative complications or post-operative complications. Intraoperative complications are related to iatrogenic injuries, so you can injure nearby structures. This could include uterine or uterocervical lacerations, bladder or bowel lacerations, as this is just basic relations of the uterus. There may also be significant blood loss, as always a risk in controlling blood pressure in anesthetic or due to injury of vessels, which is less likely. And you may also require transfusions with the blood loss and the associated complications with the transfusion reactions. Post-operative complications include endometritis, so inflammation of the endometrium, wound infections, atelectasis, pulmonary embolisms, and UTI, so common post-operative fever causes. So we also want to consider risk factors for complications. There may be high or low fetus birth weight, a higher maternal BMI of 25, and a higher maternal age. Thank you for watching. I hope you learned something. If you did, please tell a friend who may also find it useful.